Hi, my name is Andrea Woodward from Webster University, and I am going to give a presentation about COVID-19 effects in a business organizational behavior. So, in my introduction, it says we're talking about stress among workers, working from home or physical attendance at the workplace, preventing major consequences, the new era, and leaders managing COVID-19 pandemic, and the bibliography. So going on, stress among workers. We all know a couple of months ago the COVID-19 outbreak happened. People having breathing issues as well as fever, getting hospitalized. We have to do different prevention, wearing masks, washing our hands, using hand sanitizers, and all of these cause, of course, at the workplace stress and anxiety. People are afraid that they are going to get in touch with somebody who's sick. As well as at this time their anxiety level gonna be higher. They need some assurance from their leaders and their policymakers that they are going to be taken care of. You have to watch their feelings gonna be highly emotions. They're gonna have more chance to get depression, anxiety, and as well as having outbursts, and just it's an uncertain time right now, and they have to feel appreciated, and they have to be assured that they are not going to lose their jobs. They can still provide for their families. Wearing masks and social distancing. Now, the new law in Springfield right now is if you're the next 3 months, if you're going out to any organizations, any shopping area, you have to wear your mask to protect not only yourself but others being protected as well. You have to follow the 6 feet social distancing. Sorry, my kids are in the background. Now, if you already had some anxiety before this uncertain time, definitely you have a higher chance to get mental breakdown. So, as part of being a leader, they have to make sure that they are paying more attention to people who are now have to work either from home or the people who are in the front line, and they are definitely in the middle of this cruel situation where they have to deal with every day. They have the chance of getting sick. Majorly, there's 2 ways how you can work right now. One option is to stay at home and use your internet, or your other option is to actually physically attend work. Now, we know if you're in a nursing home or a hospital or any other places like this, you definitely don't have a choice. You have to go and take care of those people in person. Now, if you're a business or anything like that, you might have the option to be at home, use your resources, use your programs, and have live meetings, have Zoom meetings, use your emails, use your phone conferences, and that's actually used to be a luxury, to work from home, where now this is more a have to do, in more safety precaution to do. Fear of getting ill, the frontline workers. I cannot imagine being a nurse or a doctor, and do 12-hour shifts, and just all the things that go through your head, and the anxiety level that you have to work with. every day being at the front line. Now, another hard time is if you're working from home and you have to make an office in your own home, but you have your children home at the same time and you have to homeschool them. It's a hard time to divide your time and manage your time, what's family time and what's work time. It's definitely gonna be a little struggle, that your kids have to go to school from certain time to get their attendance and get their schooling done. And now here in July, my kids are actually going to summer school and attending at the school. Now in June there was no option and they had to actually attend through the internet their courses. The next thing I would like to talk about is preventing major consequences. As earlier mentioned, leaders have plenty to stress about. They have a lot on their shoulders and they have to protect everybody and help them if they are too stressed out. They have to have different ways to offer stress relieving techniques, as well as they have to be the ones who very early on have to identify if there's any problems and what are the ways to go and what they're gonna do about. We have to always offer a healthy and safe work environment. We have to make sure there's masks, there's social distancing if needed, there's sanitizers, there's soap, everything you can do to provide them to feel safe, because the more they feel safe, the more they're gonna be on board to attend work and do their part of the job. Now, not only you have to look out for their physical needs, as I said, you need to promote mental health. They have to have maybe a counselor or somebody they can go and talk to about if they have any kind of issues, if they need to talk to somebody, if they have any needs at home, maybe they have some needs to protect their families and they cannot do that because it's a hard time for them. Maybe you can help out and help them out to feel safe. At the same time, you want to make sure they are showing appreciation at this time. They want to feel that their workplace is actually appreciating them and they aren't just going to use them and then they have to worry about losing their job. They have to feel safe. In my last slide, we're we're talking about a new era where less in-person meetings are going on right now and more is going on through emails and other distance communications. So as I said earlier, learning about flexibility and arrangements is very important, where the employees have to show flexibility to the workplace and help with arrangement for the workers to protect the organizations. Our upcoming new procedures and public interactions. These modifications are very vital to support the workers take off a load of stress level. Leaders managing COVID-19 pandemic, there are 5 main steps. The first main step is keep emotions in check. With that saying, it means that it is really important that the leaders are being truthful with their employees, as well as be realistic regarding their status, and show that you're not panicking about the situation. Always give your workers the most up-to-date information that's available and offer all the supports they needing. Number 2 is remain realistic. So super short and sweet about remaining realistic is from time to time the leader, he or she cannot assure their employees that everything's gonna be okay, but that's fine. Therefore, as long as you have a realistic optimism and see the potential result that will be at the outcome, that's gonna be all right. Showcase both the best and the worst scenarios. That way, all your employees gonna be ready for either outcome. Number 3, adaptive is the key. So, sorry, having a 5-year-old is kind of ridiculous right now at home. So, adaptivity is the key. People who make smart adjustment in the policies and work with a minimal risk, they have to have an effective communication in between the team members to explain what the team goal and expectations are. The leader will decide which instruments are the best for people to work with, and some flexibility and engagement gonna have to happen between the leader and the team all the time. This is a very important connection. Number 4 is encourage empathy. It is really important to try to deliver empathy and talk about feelings between the members, to encourage and have a trust building exercise between the leader and the team group. Listen to the staff, what they have to say, and relate to their feelings. Number 5 is empower your people. Promote self-care and equality. You have to show and explain how one another can help in this team exercise, what they are doing. Important to work together as a team and collaborate each ideas with any useful tools for the better outcome. And remind the team members how important it is to take care of each other in this certain time. And after all this has been said, of course, I am showing all my peer-reviewed resources at the end of these slides. Thank you for your time, and if you have any questions, please let me know.